and we will be discussing the incarcerated population today.
So just to begin, a little bit of a background on the incarcerated population. With the research that we compiled, there were sources that relate that there were over 1.4 million incarcerated prisoners within the United States, with those rates continuing to increase over time. With this high rate of incarcerated population individuals, it leads to overcrowding, unsanitary living, and eating conditions, as well as a decreased access to healthcare. From the information that we found three major concerns and challenges for that population. Mental health, they have high exposure to stressful situations leading to depression, thoughts of suicide. Reproductive health, with women, there's no current standards and treatment for incarcerated pregnant or postpartum women. And then reentry to the community, where they continue their health care. It's not easy for them to be able to access basic health needs after release. So overall, the role of the primary care team is to help address the poor health status of incarcerated individuals, just by working to combat those health disparities within our own communities, and then providing the accessible preventative healthcare services to improve these vulnerable individuals' quality of life and overall health of the community.
So, just to expand on the role of the primary care, a large portion of the incarcerated population comes from marginalized segments of society where they have poor overall health at baseline. This population has complex health needs that require adequate medical attention in order to properly control and treat these illnesses. So, the incarcerated population has a high prevalence of chronic disease, including hypertension, diabetes, asthma, and infectious diseases. Mental health illnesses are frequent, as well as substance use disorders. So, primary care in prisons and in the community is often the first point of contact for medical care for inmates, which is why it's so important. It emphasizes prevention, early detection and screening, as well as management of chronic diseases throughout the lifespan. And so, having adequate primary care can improve the health outcomes for incarcerated individuals, combat health disparities, and reduce long-term costs for both the healthcare and prison systems.
So now diving a little bit more into the review of literature, we'll just begin with the search strategies that we utilize when finding our references. We primarily utilize Medline and CINAHL databases, and those all included qualitative, quantitative, meta-analysis, and systematic reviews. With the search criteria, we wanted to use peer-reviewed articles that were published within the last 5 years, and we use particular terms such as barriers to healthcare, health inequalities, preventative healthcare, primary healthcare, correctional institutions and imprisonment, and then prisons. And that led us to being able to gather less than 50 articles total to be reviewed. From the articles that we ended up selecting for our paper, we utilized the Johns Hopkins evidence-based research evidence appraisal model, where all the articles that we were using were primarily level 2 or level 3, according to that appraisal model itself.
So there were three emerging themes that we found while reviewing the literature. The first one is concerning the mental health of inmates. So the mental health services currently available to the incarceration population is inadequate, and this is often due to underfunding, poor screening, and lack of staff knowledge. And the inadequate mental health treatment is often exacerbated by racial disparities and health inequalities. So it was found that African American inmates are more likely to receive inadequate treatment compared to Caucasian inmates. The next theme concerns women's health, specifically reproductive health. Their needs are not currently being met. One-third of the incarcerated pregnant women receive inadequate prenatal care, and correctional facilities participate in medically unsafe practices, such as solitary confinement and shackling use during labor. And it was found that correctional facilities are not required to follow published reproductive health care guidelines, which results in variable standards of care across facilities for pregnant women. Lastly, there is the concern for reentry failure and the continued health disparities that inmates face upon release. There's a correlation with poor psychological and physical health outcomes post-incarceration. And inmates are more likely to return to underserved communities with limited medical resources that allows them to face more health disparities upon release.
Leading into our discussion, we'll begin with the socio-political aspect. So there are risk factors for becoming incarcerated where members of the incarcerated population are more likely to come from the underserved communities where health disparities are most prevalent. Poverty, substance use disorders, trauma history, and limited access to healthcare services are other risk factors for becoming incarcerated. Then there's the racial disparities and the systemic biases that are experienced both in the community and while they're in custody. More specifically, African American individuals tend to be imprisoned at twice the rate of Caucasian individuals. These Black inmates often experience worse treatment and restricted access to mental health services while in custody compared to white inmates. And then correctional staff are actually more likely to request healthcare assistance for white inmates compared to Black inmates.
Some legal concerns include the fact that incarcerated individuals make 41% less than non-incarcerated individuals, which results in their inability to pay for quality legal representation or court fees to aid in their defense, which further increases their likelihood of becoming incarcerated. And then during incarceration, there's concern for violation of human rights and increased health disparities overall. So the problem of overcrowding, results in decreased sanitation and poor air quality, which increases the likelihood of disease transmission, putting their inmates' health further at risk. The concern for solitary confinement is often seen as a violation of human rights. The meals served in prisons are often unsanitary and do not meet the recommended daily nutritional needs, leading to more illness, weight gain, hypertension, and heart disease. And women's health needs are often overlooked or go untreated due to the lack of prenatal care or programs established to help pregnant women while incarcerated.
Moving into the ethical side of incarceration, there is an ethical duty of healthcare staff where it's their responsibility of, more specifically, the healthcare providers to offer the non-biased equal care to all individuals. This ethical duty has been challenged by systemic constraints of that overcrowding and therefore understaffing due to the mass incarceration in the United States among correctional facilities. And then it moves into proof of character, where inmates must prove their good character for staff so that they can believe them when they are sick and requesting medical services. And finally, it leads us into denial of health care, where medical request forms have to be completed by inmates, and they're requesting those medical services. And the request forms are therefore often misplaced by correctional staff or even denied by medical staff.
So the quality of health care available to inmates in the correctional facilities in the United States is so poor that legal action has already been taken. The California Department of Corrections and Rehabilitation has faced many lawsuits over the quality of health care available to the inmates, resulting in required federal oversight for future healthcare services within this facility. More factors that lead to the poor quality of healthcare includes the poor quality of the healthcare providers. Medical providers that are available to care for inmates are often either in the training role, in the student role, or new graduates with little experience, or these providers are often deemed unfit to serve the general population due to multiple malpractice suits. So the poor quality, the combination of poor healthcare providers results in distrust and underuse of the health system among inmates, even when medically necessary, allowing medical conditions to go undiagnosed and undertreated.
And then we move into safety, where exposure to dangerous prison environment actually threatens inmate physical and psychological safety. There's high violence rates within the prisons and jails, often due to the overcrowding. There's poor protection that's offered by the correctional staffs themselves, and there's a mental health stigma of prison culture. And then there's also the reentry safety aspect that comes into play, where inmates are more likely to return to underserved and marginalized neighborhoods upon release, with more high rates of violent crimes. Social discrimination and systemic racism increases risk for hate crimes. And then finally, vulnerable transition period threatens the mental health wellness for these incarcerated individuals after release.
So we will move into the discussing the Ignition values and how they can help improve the health status of this vulnerable population. So we can start with the value of Magus. It invites us to work in a spirit of generous excellence. So the provider caring for the incarcerated population can use this value when they strive to meet the highest standards for all healthcare settings and populations. They ensure all inmates receive the same standard of care as the general population and advocate for mental health reform within correctional facilities with access to qualified mental health specialists. The value of reflection invites us to pause and consider the world around us and our place within it. And this can improve the health outcomes of this population by allowing the provider to evaluate healthcare needs and of prisons and jails to help find gaps and areas of improvement, as well as reflect on previous failures and successes in healthcare to reform these practices and policies within the prison system.
Next, we have discernment, which invites us to be open to God's Spirit as we consider our feelings and rational thought to make decisions and take actions that will contribute good to our lives and the world around us. With the incarcerated population, and providers demonstrate the value of discernment in practice when caring for these individuals. And they do this by directing their attention to implementing policies within prisons and jails that can help improve healthcare programs and reentry success, such as mental health services and chronic disease management. With Cura Personalis, it invites us to view each person as a unique creation of God. So in caring for the incarceration population, this can help improve health outcomes by placing an emphasis on inmates' physical, emotional, mental, social, and spiritual health and well-being. It can offer comprehensive, holistic health assessments that respect the uniqueness of every individual and then even respect the dignity and diversity of every inmate when creating treatment plans.
Lastly, the service rooted in justice invites us to invest our lives into the well being of our neighbors, particularly those who suffer injustice, especially the incarcerated population. So, utilizing this value can provide a strong ethical foundation for nurse practitioners, specifically caring for the members of this population by addressing systemic inequalities and promoting social justice in the form of advocating for health equity to combat health disparities within correctional facilities and surrounding communities. We can advocate for inmates to receive timely, quality, comprehensive, and specialized medical care during their time in custody, as well as screen for social needs upon release, including their lack of access to nutritious food or inadequate housing, and use the referral system to get in touch with community resources such as social workers and legal advocates to help with the vulnerable transition period through reentry.
And then looking into future implications, primarily focusing with the nurse practitioner role and stakeholders that are caring for the incarcerated population. Implications for the nurse practitioner would be following the holistic approach, so recognizing the impact of life experiences on health and lifestyle habits, utilizing that holistic approach in care. Recognizing complex needs. The incarcerated population has very unique needs that must be considered, such as life circumstances and past experiences. Focusing with the patient-centered care model can help. Just incorporating patient preferences and concerns and treatment plans, often associated with positive patient outcomes overall when utilizing this method. Improving community outreach by targeting underserved communities to reduce health disparities and enhance access to quality care. Reintegration programs, they can help support transition from incarceration to community and overall just help reduce the reentry failure rates and improve their well-being. And then there's many other support programs that can be looked into. These are just a few that we listed, but there's many more outside of this. There's mentorship programs for guidance and support. There's housing assistance programs, job training programs, health literacy, educational services, and it really just emphasizing the importance of establishing with the primary care physician, nurse practitioner, physician assistant, even just after they get that release from prisons and jails.
So, in summary, primary care providers have a unique role in helping to improve the health of the incarcerated population. Primary care is essential in promoting preventative health practices and enhancing the overall health and well-being of individuals and communities. The vulnerable population, this vulnerable population has faced significant challenges and health disparities that result in poorer health outcomes, both during and after incarceration. To summarize, there's widespread and often untreated mental health issues among this population. Women's health, specifically reproductive health, needs are neglected, and there's a lack of standardized treatment protocols. And the challenge of reentry often results in obstacles in continued facing of health disparities even after release from prison. So, in conclusion, there is an urgent need for comprehensive healthcare solutions to be created that are tailored to the unique needs of this population in order to improve their future health and well-being.
References.
Thank you.
Thank you.